A community in the central region town of Saltpond receives training on the Community Scorecard. The Community Scorecard is a new initiative used to assess the effectiveness of Ghana's community-based health planning and services. In January 2018, the Community Scorecard was introduced by Ghana Health Service and Ministry of Health with support from the African Leaders Malaria Alliance, ALMA.
Our primary healthcare system works within structures. So we have the health system, the CHO, we have the volunteers, and we have the Community Health Management Committee. The Community Health Management Committee are supposed to be supporting the design and the delivery of the services at the community level with the support of the CHO, and the volunteers moderate among them. The gap we have seen so far all along had been that the CHO works to the best of his or her ability. But that engagement of the Community Health Management Committee and the volunteer basically was atrophied because it wasn't there as much as we had wished.
Before the Community Scorecard came, there were challenges getting feedback from patients as part of input for improvement. So we had other initiatives such as client satisfaction surveys. But for quality of care, experts say or agree that experience of care is a better measure of quality of care than client satisfaction. And there were also difficulties conducting these client satisfaction surveys every 6 months. That is the Ghana Health Service policy, because of capacity issues. And because people do not have the capacity to do, they always have to contract other people and they have to pay to make sure these client satisfaction surveys are done. And when they were done, then there wasn't any bit about accountability because the recommendations are usually just filed as a report.
In 1996, the Ministry of Health and Ghana Health Service launched the Community-Based Health Planning and Service Initiative, or CHIPS, as it is commonly known. The aim was to encourage communities to become more active participants in strengthening health systems with the ultimate goal of achieving universal health coverage. This Community Scorecard was introduced to bridge a key gap identified in the CHIPS system. The Community Scorecard is an accountability tool that allows community members to provide quarterly feedback on health services and create action plans to address bottlenecks.
The Community Scorecard initiative gives us room to actually pick the necessary feedbacks, things that the people want to tell us, right, that they can come up to tell us because of distance, because of the challenges. And I think this initiative will generate some interest by community people, people who live within the cities, to begin to become closer to facilities, get closer to our health professionals, to tell us things that they need to enable them, to enable us to serve them better.
The Community Scorecard has come to further empower our communities and to bring into fullness the meaning of CHIPS, and has also empowered them to get involved and then to bring on board what they think are their pressing needs, even including aspects that the community health officer could not have done.
Before we go to the Community Scorecard in action on the ground, here is an overview of how the process works. The Community Scorecard consists of two main components: a scoring session during which the community members provide feedback on 9 indicators related to the quality of health services in their CHIPS zone, and importantly, the development of Community Health Action Plans, CHAPs, to address the issues identified during scoring sessions. Every CHIPS zone is supported by a group of 7 to 13 community leader volunteers known as the Community Health Management Committee. Before the scoring is conducted, participants visit the CHIPS Health facility with the community health officer. This ensures everyone is familiar with the context. To begin the scoring session, the Community Health Management Committee Chair, who facilitates the sessions, explains to participants how the scoring works and describes the 9 indicators on the community scorecard. Each indicator is scored on a scale of 1 to 3, with 1 being poor, 2 average, and 3 good. The score, which receives the most votes from participants, is recorded into the community scorecard scoring form. The 9 indicators discussed during scoring sessions are: 1. Caring, respectful and compassionate care. 2. Waiting time for the provision of healthcare services. 3. Availability of medicines, diagnostic services and medical supplies. 4. Availability, accessibility and affordability. 5. Leadership and management of facilities. 6. Cleanliness and safety of facility. 7. Home visits by community health nurse. 8. Home visit by community health worker or the community health volunteers. And finally, assessment of national health insurance services. After the scoring session, participants use the scores to identify at least 3 priority areas requiring action. These community-led actions are documented and monitored through Community Health Action Plan, CHAPS.
In the Community Health Action Plan, we advise the committee that they come up with solutions that are homegrown, are community-based, that they themselves, when they come together, they can solve it. And so we don't expect communities to pick so ambitious projects that they cannot complete it. And when that happens, it demoralizes them and they will not want to continue to do it the next time.
The scores are uploaded by health information officers into the National Health Information System, DHIMS. This is linked to an online scorecard web platform that produces color-coded community scorecards. With this online functionality, scorecards are made available to all stakeholders, and the website is www.rmncah.org. In the Central Region, the Health Directorate has conducted orientation on the Community Scorecard since 2018. Most recently, they've received support for further scale-up of the Community Scorecard in December 2019. This was made possible with support from ALMA through the Policy Planning, Monitoring and Evaluation Division of the Ghana Health Service. Community scorecard trainings usually last 2 days and require the participation of Community Health Management Committee members, as well as community health officers.
The nice thing about the scorecard is, in the community, you will write the scores on paper, but then you give this paper to the DHIO, the District Health Information Officer, and he or she will put those scores into the website, into the computer. And the computer will combine the scores. So then the sub-district can see how the sub-district is performing. The district will see how all of these scores are combined at district level. The region will have a picture of how all of Central Region's health facilities are performing. More importantly, it gives the community an opportunity to have their voices heard.
Initially, we were not having that CHIPS concept perception well with the community members. So their involvement in most of our programs was very low. And today, with the community scorecard, has really made me so happy because it has introduced them to know what to do as a community health committee members, as community health volunteers. As they are living here to their various communities, it will help us, the workers there, to run our services smoothly, to enhance the health status of all the people living in Wissamfo and its environs.
The community people are empowered to look at how they look at the services that we deliver to them. And what I mean is that they have been trained and then given the tools to use.
The Community Scorecard Initiative has been rolled out in 10 regions of Ghana, namely the Ashanti region, Western region, Bono-Ahafo region, Central region, Volta region, Oti region, Northern region, Savannah region, Greater Accra, and the Upper East region.
All of the thing that we are doing is to move towards quality improvement. But as I said, initially we're just looking at the supply side of business. That is, how are we performing as a health sector? But then the gap was, how do those that we are offering the service look at us in terms of quality? Because technical quality can be very different from experiential quality. So then the community scorecard was then set up, asking some very basic questions.
Again, because they also are a community voice, they also gather information from the other community members or family members who have experienced the same healthcare within that catchment area where the zone is or where the facility is.
This is the Okwampa Chips Zone, Owutu Senya district. Linda has been serving in this community for years. She is considered by many of the residents here as a committed and dedicated community health officer. The Community Scorecard has introduced a district level of efficiency for her work here.
The Community Scorecard has really helped us in our work because the community members are more involving. We can say that through the Community Scorecard, we now don't stress ourselves when the surrounding is weedy. The community members volunteer and comes to weed anytime there is weedy surroundings.
Now that her work has been made easier and community participation has improved, Linda finds time to engage in capacity building as a way to support the community. Many of them, especially the women, have benefited from her child welfare and liquid soap making sessions in Okwampa Chip Zone. In fact, some of them have found a business with the skills acquired from Linda.
Wachira yensano eduma nso a yebɛfa so edidi enye se faso bebreba obenya kakra kakra wo eduma bia na wo de aka ho na wo de boaboa wo ho kakra kakra.
Here at the Kwaman Chips compound at Aguna West District in the Central region, the community is owning the project. Together with their chief, the people here have built a befitting washroom for the Chips facility.
Edikan chip compound ba ya yeto committee no yetena se na ehun se nurse fo no wasi wo modan na ade na awie ye no wo ma wo mo washroom na ade wo inside enti na members no wo ba ne se obi pese oye no hu ye ya onye ba bi enkwaye no hu ye nti bush ho na ya ama wa ama na kwan se onko bush ho ama okwan nti na bibia ekokroma o complain anadwekra na ọkọ bush committee no yetena se yen how kese ya yehu ye ne se na apemfo na mofra obi oba he bia ba ne se toilet kana onye ba bia ọkọ toilet na ye ho adwen se ekwakotena na anim no kwasem ye ni ajepa se yede asem no kọ dwumadi a yedi no yerekotena na anim no na nanom so wonim se ya de papa mo atumu abaya ama ye nti ye bo ma ba so 100% o ma ya de pa ya me hira o ni aje o mo.
In the Volta region, a similar problem has been solved thanks to the community scorecard system. A septic tank is being constructed for an existing washroom near the CHIPS facility.
I'm John Kamasa from Avema. I am the organizer. Le miape takpekpe ke mie wo alo workshop ke mie wo le bata. Mie de jesi kuhui wa me eton a sheki le takpekpa me. Be wo wi nye nu ke le fuden la miape Avema chip compound. Yet economic body mio health committee o mie gbogbo no anyi ye mie ba de jesi eyonye vivito am eton. Wa wi nye septic tank, le poly tank, le vaccine fridge. Ike mia azan le tepa wa de mia jigba. Ya ta mi cho wa me eton wo be mia je wo do wo gom. Le mia pe workshop amedi. Ya mi de jesi le pa bedi. Ba mi nya be ale nenema nu le o. Ya ta le workshop ala ya mi helps ami yo electronic ade. Ya mi de jesi. Yata le jesi de me kene mia committee mi gbogbo va no anyi vodi yemi ba pe be no elebe na mo vade ugbo na foji dege na ameva jivide.
The problem, discovered through the scorecard system at the Domis Sampaman CHIPS zone in Kotoku, a community in the Gawes municipality of the Greater Accra region, was bats and reptiles, which created a terrible odor at the facility. The story has changed as renovation works were ongoing at the time of our visit. The Domis Sampaman CHIPS zone has a new look, and nurses will soon begin work in this facility.
It came to light that the center is being disturbed by bats. So we met and decided to combat the disease or the bats. The stench was too much for nurses. So they came and sprayed the area, but still it was not okay. So we asked the assemblyman, we talked to him. So we wrote a letter to individuals, to this assembly, churches, mosques, to come to our aid. But it was not coming, so we contacted the assemblyman, who also petitioned our request to Honorable Sedem Afenyo, who came in. He has made the place ceiling, provided the ceiling, and then there is ongoing painting work at the center. So very soon the nurses will come in.
Madam Ase, I'm say, and say yedi bibi atu abanso. Se bibi na se aban be ya ma wo kru mu sa ati se we ya ye kan yi. Na me ni me mpɛn for e better say na say kra em say en so ani nti hia e mpɛn for no hwɛ okwan e be fa so a em say ye cheap compound we and kokra because sebi brothers ye che no nya obi a na wanya saa akwenya yi because e ko ba say ese krampo amoa no bat no ha wo mo a wo ho no me sure say me dan we mu be kwa akohwe ho efie no ya ma nurses no baby compact a wo mu ye adwuma na yemfa train adwuma no ayeye wo ha no.
I was on a constituency tour introducing myself to the chiefs within the constituency, and I happened to visit the chief in this locality, that's Don Sampama. There was a smell in his house, and I was wondering where that smell was coming from. So after the introduction, he actually told me that the CHIPS compound next to his house is where the smell is coming from. So I was motivated from there to actually support and put the place in order, so that at least the 5 or 6 communities within this electoral area can have their CHIPS compound back and then have healthcare within.
In the Greater Accra region, the situation is the same at the Tema General Hospital. Through the community scorecard, inadequate lighting system and water problems have been solved.
Through this, we wrote a letter to the Metro Assembly and then met the presiding member and then an NGO which also came to our aid. So through the stakeholder engagement, we had Amadia Foundation to donate a polytank, a Rambo 2000 size polytank, to help address the water issues at Tema General Hospital. Through the stakeholder engagement also, we got the assembly to get the ECG to help us fix the street lights, which are working now. So work is in progress. I am very happy that the community's involvement has been able to make a positive line to the hospital. So the community involvement is very, very, very vital, and work is ongoing, and we hope to do some more.
The impact of the community scorecard is obvious, and several CHIPS compounds across the country have had their share where it has been implemented.
Having rolled out this tool and having gone around for monitoring and having taken feedback from both the community and the CHO and regional managers, one common thing that they continue to say that now the community has got more voices to speak. They have gotten some level of power because we have been able to simplify and define indicators for them to follow.
What I can say is that now the CHOs, the community health officers, are well motivated and they are doing their best. As the community health management committee members are supporting them in service delivery. And also the community health management committees and then other stakeholders have mobilized a lot of resources to support service delivery. So it looks like now it has actually improved the implementation of CHIPS in this district.
At the moment, if you go to some of the places that are piloting, then you see there's now a scramble for contribution to the CHIPS as a result of what the scorecard has revealed. Hitherto, it's difficult to get influential people, not necessarily politicians, influential people, philanthropists, to come in to assist because they did not even understand clearly their role in the CHIPS implementation in the region.
I have been totally amazed what communities can do by themselves to contribute to quality and safety if given the opportunity. Because through this community scorecard, communities themselves have been able to diagnose what the problems are within our health systems. They have suggested solutions which we have taken up and implemented. But more importantly, they themselves have also mobilized resources that they have used to solve some of our problems. And we think that this is a very beautiful partnership for improving our health systems towards the state of quality and safety that we want to see as a Ghana Health Service and by extension, the Ministry of Health and also Ghana as a whole.
2 years of scorecard implementation in communities across Ghana has revealed some important lessons. First, it has improved the relationship between community and nurses in the CHIPS zone. Secondly, it gives communities a voice in health. Thirdly, it provides an opportunity to assess and strengthen the process of CHIPS implementation. Fourthly, highlights that improved availability of drugs and supplies require higher level decisions and actions by the Ministry of Health and the Ghana Health Service. Finally, that partners add value and work closely with the health systems.
One key lesson I've actually learned is that when community management committee members are involved in identifying gaps in service delivery, they are more likely to help in mobilizing resources for service delivery. You know, it's different from telling them, I need a pen. But because they are with you and they realize that it's the pen that you need, they'll go forward and find the pen for you.
One of the lessons of the scorecard that I've come to appreciate is the awareness that this has created among the people that we serve. Now, the concept of the community coming together, plan their services and deliver, without looking somewhere for support, is downing on the communities very well. So even though they may not have everything, but I see that they are trying their best to solve the problems within their limit. And that in itself is a big plus.
Community scorecard and to pressure my cry. Abama Juma Edin, Ako ye fine, because a Ben baby to sinto. Near ya to me, Abo ye, pa to me, I Jumani, and I had better pressure my cry. Tea, ya penisasa abakanya, never nasi.
On the community scorecard, I realized that the rating, the point that patients come to the facility and takes longer time was their problem. So with this community scorecard, we actually improve on that aspect, either by coming to work very early or by actually writing to the district to give us more staff so that when patients come, we actually multiply up and then give them the services they need to get before they leave to their various houses.
Having recorded these successes, it is imperative for the Ghana Health Service to work effectively with the partners to move to the next phase of the community scorecard.
For me, there is a plan for the entire scale-up, to cover the entire country as far as the community scorecard is concerned. We're also mobilizing a lot of resources internally to do this.
The next thing is to look at the leadership. Leadership from the community health officer, leadership from the sub-district leader, leadership from the districts. So we need a leadership training, and going forward, that is the next focus. We need to train leaders to adopt this.
Another thing we need to do in standardizing, we need to ensure that the committee members' capacities are enhanced to know what to do. Because if they are not well trained on how to conduct the assessment, they will go there and delay unduly, and this can discourage other well-meaning committee members in taking active part in the process.
As of June 2020, with support from USAID, World Bank, Ubora Institute, WHO, and the African Leaders Malaria Alliance, approximately 1,400 out of 6,000 CHIP zones had been trained on the community scorecard. This represents 23% coverage in the country, in 12 out of the 16 regions.
I think the community scorecard has come to stay. We don't have a choice. It is a very critical tool if we truly want to make sure that the voice of the patient and our communities and their families are actually at the center of healthcare, which is what the National Healthcare Quality Strategy, launched in 2016, seeks to achieve towards quality universal health coverage by 2030 and beyond.